You know, lots to discuss in this make or break month for healthcare reform. Joining me live now, Congressman Tom Price of Georgia. He has been a doctor for, what, more than 25 years?
Right.
And helped write the Republican proposal for healthcare reform. Doctor, representative, good to see you. Thanks for your time.
Thanks, Tony. Good to be with you.
I spent some time on YouTube this morning just trying to get a better handle on your view, your positions on healthcare reform, and it's clear to me that you believe the current system is unsustainable. But you clearly also have some real issues and concerns about the public option as it's being discussed now and being shaped. I want to give you an opportunity to tell all of us what your concerns are, because we're hearing some of this reflected in some of these town hall meetings.
Well, the status quo is unacceptable. Clearly for patients and for doctors and for the entire system, it's unacceptable. But what we believe, what I believe, is that we need a patient-centered system, not an insurance-centered system or a government-centered system, but a patient-centered system. And a government option, a public plan, will inevitably skew the playing field so that tens of millions, if not over 100 million Americans will be forced from their personal, private health insurance onto the government plan.
Do you really believe that?
Absolutely. It's happened in every other instance. And let me give you an example.
Sure.
The Medicare Part B program, which is the physician component of Medicare, is a public option.
Right.
It has a 97% market share, crowds everybody else out of the market, so that everybody ends up on the government plan.
Do private insurers really want to be in that business?
Well, you don't know, because the government skews the playing field. I would suggest that that private insurers, personal insurers, could create greater dynamism, greater innovation, greater responsiveness in the system. But instead, what we have is a government-run system. That's what a public option looks like in the United States healthcare system.
But a public option, would you agree, is not an option for everyone? I mean, as we sit here today at this moment, neither of us would qualify for the public option under any of the proposals being talked about now, correct?
Well, you wouldn't today, but you might in 5 years when CNN has a health insurance program and policy that doesn't necessarily comply with every single component that's defined in the House bill right now. You would be forced onto a public option plan. And that's why we have great concerns about it. Now, there's a better way. There's a way to make it so that patients are in control, not government or insurance companies. That's what we put together in our bill, H.R. 3400.
What's the center of that proposal? Is it deductions? Is it tax credits? What is it?
A couple items. One is that everybody's got to get insured. You've got to make it financially feasible for folks to be insured.
And I should say, you've been consistent in that point.
Absolutely.
And everything I've heard you say in your public comments, you've been consistent that everyone has to get some kind of access to the system, right?
Absolutely, and you do that through a combination of tax deductions or tax credits or refundable credits.
But can I stop you there for a moment? Isn't that essentially the plan that that John McCain ran for president on?
No.
In the health care debate portion of the broader discussion?
He talked about tax credits, and that's one component of it. Where we differ is that we believe there ought to be a hybrid system. That is, make it financially attractive for every single American to have health insurance. And for some individuals, that's deductions. For some, it's credits. For some, it's refundable or advanceable credits, so that they aren't paying enough in taxes to be able to have a credit make any sense. Then they would get an advanceable credit to be able to purchase health insurance.
Is it true that even under your proposal, there would be a significant government involvement in healthcare reform? Even under what you're talking about?
Just for the construct of the system. Just for the construct of the system. But patients would be in charge. We need to make it so that there's portability in the system, so if you lose your job or you change jobs, that you can keep your health insurance. It goes with you. That's one of the big concerns that folks have today. We need to make certain that quality in healthcare is defined by physicians and by patients, not by a federal bureaucrat, which is a huge concern of many folks. We need to address the lawsuit issue, which is something that the bills on the other side of the aisle don't do at all, and we need to do it all without raising taxes. H.R. 3400 does every one of those things.
Are you concerned that in this summer, this make-or-break summer for healthcare reform, that real substantive conversations, like what we're trying to have here, are being drowned out by a lot of the, frankly, the yelling, the screaming, some of the stuff we saw at Senator Specter's town hall at the top of the hour?
Comes from both sides, but I would suggest that the yelling that you're hearing is a symptom of the process that we've been through over the last 6 months, and that is a process that has shut out so many people in this debate and in this discussion. The American people are concerned about folks not reading the stimulus bill, passing things in the dead of night that nobody reads, and they're concerned that if that happens with health care, that they will be thrown into a system that will not be responsive to them.
All I can do is speak for these 2 hours, and we have been trying like crazy to get every voice, every stakeholder, to have those voices heard. And to the extent that you can, would you help us?
Be happy to. Anytime.
Representative Price, thanks for being here. It's
Thanks,
good to see you
Tony.
again.
Good to
It's been a
see
while.
you. Thank you.